I don't think I even need these microphones. My voice carries throughout the room most of the time. But again, I'm Eric Edwards, and I'm on the board of directors for Dialysis Patient Citizens, which is a nonprofit patient-led organization that's dedicated to improving the quality of life for dialysis patients. And the way we do that is through education and advocacy and promoting better patient-caregiver coordination, teamwork. A little bit about me briefly, as she mentioned a few minutes ago. I was diagnosed with chronic kidney disease at a very early age, around 8. My mother came home from work one day, and as she typically does, she was going over me and my sister looking for cuts, scrapes, bruises, and she noticed that my ankles were swelling. So she thought it was either I was running around playing too much, so she decided to give it a night, and then we'll check it out in the morning. So that morning before she left to go to work, they went down a little, but not much. So when she came home, she spoke with my grandmother, and they decided to take me to the emergency room. And that's when the journey began. So I was in the hospital from that day for about 2 weeks while they tried to run tests and figure out what exactly was going on with me. They wasn't really sure in the beginning. So eventually the nephrologist came in and told them that I was in the beginning stages of chronic kidney disease. I think I was at stage 1 at that particular point. So my mom didn't, even though kidney disease ran in my family because my grandfather was on dialysis at the time, and I had an uncle who was on dialysis, and she was praying with all her might that I wouldn't end up on it myself. But unfortunately, the doctor said that was going to be my fate, unfortunately. So she did everything she could to find out as much as she could about dialysis, and she really kind of slowed down the progression of it until I was around 18, 19 is when I went on dialysis for the first time. I had a transplant shortly after going on dialysis, about 3 months later, and that transplant lasted for 6 years, and it failed again in '99, and I went back on dialysis for the second time. And unfortunately, this second time it came at a very inopportune time for myself. I had a very good job, living in the city of downtown Atlanta, nice car, nice apartment, really on the swing. Got sick, wasn't able to keep my job like I thought I was going to be able to, because unfortunately the dialysis process is really draining on the body, especially in the beginning, and for people who really don't know much about dialysis, changing your lifestyle, changing your diet, really rearranging your life is a very difficult process for a lot of dialysis patients. And for a while, it took me a minute to kind of get back on my feet. As I was explaining to Kofi earlier, I went through a little bout with depression. I was kind of thinking it was hopeless, it was pointless, I was never going to be able to return to the life that I once had. But that was because I didn't know much about dialysis and the modalities and the treatment process, and I had to educate myself. So that's one of the most important things I feel that really all advocates should be advocating for, is educating their patients, because once the patient becomes the expert on their life, we can kind of really do away with a lot of the disparities that we have with, as far as mortality rates and African Americans, Hispanics, or minority groups being disproportionately affected by many of the secondary conditions that are brought on by dialysis, or dialysis being brought on as a secondary conditions from either hypertension or diabetes, as she explained earlier. So, so I got myself together. I found a very good organization, Dialysis Patient Citizens, decided to get involved and really begin to educate myself and get out and educate other patients about their condition. And the more they know, the better their outcomes can be. If you really begin to educate yourself and become an active participant in your treatment regime, or part of your treatment machine, you can find that you can return to a lot of the things that you did prior to being on dialysis. The president of our board of directors, she'd like to say that having end-stage renal disease, it just means that's the end of your kidney functions. It doesn't mean that's the end of your life. And that is such a true statement, because as I was saying, education is the key. And once patients become aware of their condition and able to participate in their treatment plan, help the doctors, help the nurses to really educate them on how best to work with them. Unfortunately, Dialysis, there's a lot of people are affected with kidney disease, and a lot of people that are on dialysis. But unfortunately, what works for one patient may not work for other patients, and oftentimes a lot of clinics, because of for whatever reasons, many of the nurses, and I've noticed over the years, I've been on dialysis now for since '99, so I'm not real good at math, but that's a long time to me. So, but what I've noticed over the years, as the nurses and the techs in the centers are becoming very busy, their responsibilities are increasing. So once before, many years ago, they were able to sit with the patients, excuse me, and really talk about their conditions and how they can control their fluid intake and what foods they're not supposed to eat that can kind of keep them from their phosphorus levels from going up and their potassium levels from going up, and really creating additional problems for themselves. But unfortunately, they don't have the time to do that now, so it's left to the patients to really kind of get with our other patients and kind of educate them about what's important and how important it is for them to learn as much as they can. So when it comes to health disparities, I think in addition to education, I just lost my train of thought, but in addition to education, one of the other things is crucial for us to do is to really come together as we're doing now and have these kind of briefings to really let our lawmakers know how important it is that the policies that they enact or the legislations that they come up with really consider the patient and the patient's quality of health, quality of life. I understand that there are a lot of things going on in their budgets and other things that are probably way beyond the scope of what you can really talk about, but what I'm confident in is that we really need our legislators' help in enacting policies and legislations that really promote education and promote advocating, so patients can, empowering patients to really become their own advocates and really improve their quality of life themselves and really get involved. So I think that's about it for me.
Thank you, Eric, for sharing your story.